Hello, welcome to the poster session for the Chauhan Lab. In our group, we have one postdoc, 4 PhD students, and 2 undergraduate students. The motivation of our research is that hundreds of million people worldwide suffer from severely irritating eye conditions, vision impairment, and blindness. Some of the most prevalent diseases include age-related macular degeneration, glaucoma, diabetic retinopathy, and conjunctivitis. A number of drug formulations and drug delivery systems have been developed and continue to be developed to treat these conditions. The global market for ophthalmic drugs has been estimated to be around $30 billion. Eye drops are most commonly used as the treatment today. However, there are drawbacks to these, such as low bioavailability, undesired systemic uptake, and poor patient compliance. In the figure on the right, on the left side, we have the administration of an eye drop on the cornea. Preferentially, we would like the eye drop to stay on the cornea for the best bioavailability. However, this isn't the case as there are other routes for the drug to go, such as the conjunctiva, the sclera, and the nasolacrimal system. An alternative to using eye drops is to use drug-eluting contact lenses. A simple method to load the drug into the contact lenses is by soaking in drug solution. The picture on the right shows the drug-eluting contact lens on the cornea, which has much greater bioavailability. However, the release kinetics of the drug-eluting contact lenses are still not favorable, as they release at very high rates, not providing the high enough efficacy to make it truly valuable. In order to improve this, there are methods to extend the delivery of the drug from the contact lenses. Examples are molecular imprinting, liposomal-laden lenses, micro and nanoparticle loaded lenses, multi-layered lenses, and vitamin E diffusion barriers, all of which this lab has conducted work in the past and in the present. Vitamin E diffusion barriers is one of particular focus right now. With the incorporation of vitamin E, this eliminates the free diffusion path and gives the overall longer drug release. There are a number of advantages to having the vitamin E barriers in the contact lenses. First, there is a relatively easy incorporation of the vitamin E in the commercial contact lenses. Once it's been added, it serves as a UV protectant in the lenses. And with the incorporation of vitamin E, this can slow the cataract development. A number of animal studies have been done and have demonstrated high efficacy of the vitamin E lenses. There's only a minimal additional manufacturing cost with vitamin E lenses, and once they've been made, they have a reasonably long storage life in drug solution. Another core area of our research is the use of polymeric microparticles and nanoparticles for controlled drug delivery. An ongoing project involves polylactic coglycolic acid, or PLGA microparticles for vaccine delivery. The common standard for delivering vaccines today is through injections, and oftentimes multiple injections. This requires skilled medical personnel to give the injections, and there's the issue of patient compliance because when patients receive the shot the first time, there are oftentimes when they do not go back to the clinic to receive the second and or third shot. The alternative with the microparticles is that they would be injected one time. As they sustain release over time, they would provide an immune response in the body that would be as effective or even more effective than the multiple injection approach. The PLGA polymer has advantageous properties, such as its degradation rates. It has a degradation regime that once it's first injected in the body would give an initial release, followed by a lag phase, and after further degradation, it would give a secondary burst release, which would match the same time in which the second booster shot would be given for the multiple injection approach. PLGA microparticles are synthesized by the double emulsion synthesis method. The H1N1 inactivated virus is contained in the aqueous phase, which is then added to the organic solvent containing the dissolved PLGA to give the primary water and oil emulsion. The water and oil emulsion is then added to a secondary aqueous phase to extract the solvent through diffusion and evaporation. Once the solvent is fully extracted, this gives the microparticles encapsulated with the virus. Below the diagram of the synthesis method, we have an SEM image of the PLGA vaccine particle. In this particular particle sample, there was a co-encapsulation of sodium hydroxide, With the encapsulation of sodium hydroxide, this promoted bulk degradation from within the particle, giving macroporous structure, which then in turn accelerates the vaccine release. The bottom right, we see a plot of the release profiles of the different particle formulations. For the first one, we see a low initial release of the vaccine in PLGA 7525. 75 is the percentage of lactide and 25% is of glycolide. The other particle formulations used PLGA 5050, which showed a higher initial release. However, it's seen that there is even a higher initial release with the co-encapsulation of the sodium hydroxide in the PLGA 5050 vaccine particles. Another core area of our research is golden lens for ocular cystinosis treatment. This is a drugless treatment used for the rare orphan disease cystinosis. Patients with the cystinosis develop cystine crystals in their cornea, which accumulate and give very painful eye discomfort. This can be alleviated by taking eye drops every hour, every few hours to suppress the accumulation of cystine crystals and to remove or alleviate the ocular discomfort. At the top right, we see images of the cystine crystals, which start as a few microns and can grow into hundreds of microns. Novel approach for removing the cystine crystals is using gold nanoparticles. The sulfur and the cystine crystals have high affinity for the gold, which allow for adequate binding. The gold nanoparticles can be incorporated into contact lenses, which we call golden lens. The figure on the left, we see in the left picture the contact lens with the incorporated gold nanoparticles, and just to the right of it, we see an SEM image of a close-up of the nanoparticles incorporated into the contact lens. Gold nanoparticles have been incorporated into different contact lens materials and have been formed by different methods. An interesting method that's been used is the in situ formation of gold nanoparticles in silicone hydrogel contact lenses. In the bottom right, we see ex vivo results from the uptake of cystine by the golden lens. Different golden lens fabrications were used, and we see that there's a higher cystine uptake for golden lens with higher concentration of gold precursor solution. The fourth core research area in our lab is investigating ways of delivering drug to the back of the eye. Currently, vitreal injections are used, which are very invasive ways of getting drug into the aqueous humor. As an alternative, we're looking into ways to give particles or administer particles to the eyes that can transport through the cornea to the back of the eye. This is a challenge as the cornea possesses hydrophobic and hydrophilic layers. In order to permeate the cornea, this will require the particles to be amphiphilic in nature. One of the particle syntheses that have been tried is a silica core conjugated with streptavidin in PLGA PEG polymer chain that's biatenylated. By adding the biatenylated PLGA PEG chain to the streptavidin conjugated particle, we're able to bind the polymer chain to the silica nanoparticle. This is what we call the Jekyll-Hyde nanoparticle. When it's administered to the eye, it folds its chains so that the PLGA is exposed, giving it a hydrophobic surface, which allows it to transport through the tight junctions in the hydrophobic epithelial cell layer. Once it transports through this layer, it then reaches the stroma, which is hydrophilic, in which case the polymer chains then extend to expose the PEG on the outer surface, giving it the hydrophilic nature. The particles then move to the endothelial cell layer, which is hydrophobic, and retakes the form of its hydrophobic surface by folding in the polymer chains once again. Once passing through this layer, the particles then make it into the aqueous humor, which are then able to diffuse to the back of the eye and deliver the drug. Basic experiments have been used to test the amphiphilic nature of the particles by containing the particles in water and seeing how they partition into an octanol phase. If good partitioning can be achieved, then this is one step in showing that the Jekyll Hyde nanoparticles have the amphiphilic nature needed to penetrate the cornea. Another important part of this project is synthesizing the particles so that they remain on the nanometer size and can remain stable at the nanometer size without significant aggregation. This project has been funded by the Ford Foundation, and more work will be continuing on this. Thank you for listening to the core research areas of the Chauhan Lab.